noise that happens to be happening in the background. I think there's construction either in an adjacent room or upstairs. But welcome, everybody. Good to see everyone. We now officially call to order Access Health Connecticut Strategy Committee regular meeting for February 9th, 2023. With that, Marcin, I am wondering if we might establish a quorum.
I believe we do, and let me just do a roll call for attendance. Steven Hernandez, Chair.
Here.
Grant Ritter. Paul Philpott. Paul Lombardo.
Here.
CC Woods.
Here.
Matthew Brackman. And Theodore Doolittle.
Here.
Thank you. Yes, we do have a quorum, Mr. Chair.
Great, thank you, Marcin. And could we have the members of the staff of Access Health Connecticut please introduce themselves as well?
Good afternoon, all. James Michel, Chief Executive Officer for Access Health Connecticut.
Hi, Rebecca McClear, Director of Technical Operations and Analytics, Access Health Connecticut.
Hi, Susan Richby, Director of Legal and Governmental Affairs for Access Health Connecticut.
Hi, good afternoon. Darrell Jones, Director of Finance, Access Health Connecticut.
Good afternoon. Good afternoon,
Marcin.
John Carbone, Director of Small Group and Product Development.
Good afternoon, everyone. Glenn Jurgen, Director of Human Resources with Access Health Connecticut.
Greetings to all. Janelle Maloney, Director of Information Technology.
Tammy
Hello.
Hendricks, Director of Health Equity and Outreach, Access Health Connecticut.
And Marcin Lechowski, Governance Specialist, Access Health Connecticut. That
Great,
concludes
thank you
our
all.
announcements.
Thank you, Marcin. And Marcin, am I right to understand that we did not have any public comments submitted?
That's correct, Mr. Chair. We did not receive any public comments today.
Thank you for that. And now if we could entertain a motion for approval of the meeting minutes for January 12, 2023. Is there a motion?
So move, CC.
Thank you. And a second?
Paul Lombardo.
Oh, no,
seconds
I
it.
can't vote. I wasn't here last time. I can't vote. Never mind.
I'll make the motion. Paul Lombardo.
Oh. Is there a second?
Is there a second to the motion? I would defer to our legal counsel, Susan Richby. I believe that Ms. Woods can make a second to the motion.
She can make a second, or I see Mr. Doolittle. Someone else could, right? Paul Lombardo made the motion. Somebody else could second the motion.
Ted will second. I think he's just having trouble with his audio.
Yep,
Okay.
yeah, I see that. All right, thank you.
Great. Can we do a roll call vote, please?
So, Mr. Chair, is there any discussion on the motion?
Oh, thank you. Thank you for that. Any discussion on the motion? Any discussion? Hearing none. Marcin, if you could please do a roll call vote.
Steven Hernandez? Steven Hernandez? Sorry.
Oh, yeah.
Thank you.
Yep.
Grant Ritter? Paul Philpott? Paul Lombardo?
Yes.
CC Woods?
Abstain.
Okay. Matthew Brackman? And Theodore Doolittle?
Yes.
Thank you. Motion passes.
Thank you for that. And I know that we have some robust updates from the staff. So on to you, CEO James Michel.
Thank you, Mr. Chairman. I'm going to ask Rebecca McClear to give this committee a summary update of the 2023 open enrollment that just ended. Rebecca?
All right, thank you, James. So the information, again, Rebecca McClear, Director of Technical Operations and Analytics. The presentation I'll go through today is as of the end of open enrollment, so January 15th. So the statistics in here may have changed over the last couple of weeks, but we're going to talk about how things went through the end of open enrollment. So this slide, I just want to start with our call center, TTEC. During the term of open enrollment, handled nearly 200,000 calls and 21,000 chat sessions over that time, which is a decrease over last year, year over year. So we continue to see a decrease in the volume of outreach of calls to our call center, which is a great indicator of one of our goals to allow folks to self-service and use the application and the information on our website to answer their own questions. So that's something we do track year over year. Also, for our enrollment, we did end open enrollment with 108,132 individuals enrolled in a QHP plan. Again, that is slightly lower than where we ended open enrollment last year, but due to changes in the market and other factors, we were right on our forecast of 108,000 for our open enrollment period. So we were quite satisfied with that. Continuing down, of those 108,000, 15,411 were enrolled selected to enroll into a Covered Connecticut program. Folks who are keeping an eye on Covered Connecticut, we know that volume increased substantially over last year's open enrollment, mainly due to the expansion in the eligibility criteria that went into place on July 1st. So we will continue to monitor that population moving forward as well. A couple other stats are standalone dental program that we've talked about integrated into our individual medical platform, our existing platform. We did see, excuse me, over 8,000 folks enroll into a standalone dental plan along with their medical plan. So that is a significant increase. I believe it was close to 70% increase over last year when our dental enrollment was in a separate system. So that was a big new initiative that we did last year, and so far it is paying off. It is worth noting that a number of individuals, 600, just over 600, did enroll in only a dental program, a dental plan rather. They did not select to enroll in a medical plan through the exchange, and that's for various reasons. But we do allow that, and so we had about 600 folks take advantage of that. A couple other items is this year, 86% of the enrollees were eligible for financial help and were able to take advantage of getting subsidies to help them pay their costs for medical insurance. Again, those numbers have increased, continue to increase year over year. So we do keep an eye on that as well. And finally, we did see nearly 26,000 individuals come in and complete an application and be determined eligible and enroll into the Medicaid program. So those numbers, while they are slightly less than we've seen in prior years, we believe that the Medicaid extension that's been in place for the last couple of years and potentially changes in the economy have contributed to the decrease in new Medicaid eligible individuals. Any questions on that, folks?
Just as one comment, if I might.
Yeah.
I just note that the 15,411, that's over 14% on the Covered Connecticut. So starting to make some inroads. Just want to note that for the record.
Sure. Thank you. Yes, we are seeing those numbers increase, and we will continue to see that, I believe, as we move forward through the next few months. March to the next screen, please. Next slide. So this, just to kind of give an overview of what our customer base is looking like. In general, our customer base for the QHP plans does look very similar to last year. The average age is slightly up year over year. And the other thing to note, I do include here the difference for medical and dental. They are fairly close, which does make sense since the vast majority of our dental enrollees are part of our medical population as well. But we did just want to call out the slight differences there in the two populations. And then we do continue to see that the majority of our enrollees do reside in Fairfield, Hartford, or New Haven County, which tracks population numbers, and that has been consistent, but we just want to point that out. Moving down to the financial aspect of it, plan selections and premiums. We did see an increase this year of enrollees using a broker to help them complete their enrollment. We're up to about 45% of our enrollees, which is nearly 3% higher than last year. So for sure, folks are looking for a little bit more assistance in knowing which plan is right for them. So we know that from working with our broker community. We do see the majority of folks are enrolled in a silver plan, just shy of 50%. But it is also worth noting that we did see this year an increase in folks who are upgrading from a bronze plan to a silver plan. And in general, we suspect that between the expansion of the covered CT eligibility this past year, as well as the enhanced subsidies that allow those consumers to purchase more comprehensive coverage, that those two factors together are allowing folks or encouraging folks to buy up to a silver plan, if you will. Looking at our the median premium, and this information, just for folks' awareness, again, we'll be speaking with the board later this month and breaking this out in some more detail. But I did just want to bring up some points, and that's that the median monthly gross premium of $847 did go up about 25% over last year, mainly due to the increase in rates that we saw in the marketplace. But we noticed that the median monthly net premium, which is the premium after APTCs are applied, remained unchanged year over year. So again, we see the increased financial help that folks are able to take advantage of. We're seeing that after subsidy monthly premium remained the same. So that, again, good indicator there that folks are taking advantage of the subsidies that are available to them. This year, we also see fairly consistent around 86.2% retention rate. So folks that were enrolled in 2022 remained enrolled in a QHP for 2023, which is a little bit down from last year. But again, number of factors there that we're looking into. But we do see that the majority of folks who retained their QHP coverage with us did remain in the same metal level plan for 2023. So whether that was a gold, a silver, or a bronze, they kept that same tier. They may have changed plans or products or even carriers, but they remained in that same metal tier. So that's a good stat to keep an eye on as well. Next slide, please. All right, so this last one, things just to keep in mind that are coming up.
Mr.
Oh,
Chairman,
sorry.
can I
Yeah,
have a
sorry.
question on the last slide there. So am I can we surmise from the fact that to go to the top line, the average age of the enrollees is a couple of years older in medical and dental? Does that mean that the 614 people that bought the standalone are quite a bit younger than our average enrollee?
I don't have that number in front of me. I do know that is on the breakout that we have some more information on for the board later this month. So, but I don't have those numbers in front of me to confirm that. But we can.
Yeah, I mean, if that number is really being dragged down 2 years by, say, 600 enrollees, that could change, the marketing strategy in terms of who to reach out to. If really it's a much younger demographic that's interested in standalone dental. Just flagging that for your,
Okay, yeah,
so
we'll take a
can
look
think
at that
about
with this. Thank you. Yeah, we'll take a look at that and provide some more feedback there. Any other questions on that slide? All right, that will, sorry, Martin, we'll continue on to the dates and deadlines slide. couple things for here. Shouldn't be news to anyone, but our Medicaid extension and unwinding. Just yeah, we currently, or as of the end of open enrollment, we had 430,000 individuals who are able to retain their Medicaid benefits due to the Medicaid extension. However, we do know that as of the January 11th, we'll be able to start unwinding that Medicaid provision as of March 31st. So we're working closely with DSS to start that staggered unwind process. I'm sure we'll be talking about that a little later on in more detail. But we are, again, working very closely with them to monitor that population. So things have already started, activities have already started occurring here in early February to get us ready for those actions coming up in March and April. As far as initial premium payments, from the consumer standpoint, in order to use that 2023 coverage, remember they do need to pay that first month's premium. So the issuers have already delivered invoices to those households. And as of the end of open enrollment, we had 87% of those policies had been paid. We do see an increase. Here, I did put this update in there that as of the first week of February, we are now up to 91%. So only 9% of those enrollees for 2023 coverage had not paid their premium as of the first week of February. Now, keep in mind, those could be 2-1 policies, in which case, it may just be a timing thing. We only get the information from the carriers maybe once a week. So there's a timing aspect there. So not too much to be concerned with. Those numbers are right aligned with previous years. So things are progressing well. We are working with our carriers to get the effectuation information for dental policies. When I did check last week, those had started coming in, but I don't have numbers on those right now. And then with our final thing is 1095, those forms have all gone out. We mailed out over 92,000 forms the last week of January. And so consumers have either received those in the mail, or if they can retrieve them, the electronic version, and download them directly from their consumer portal account so that they can file their 2022 taxes. We have, as in years past, have increased our team and our staff to handle any calls with questions that folks may have for correcting or questions on their 1095 forms as they prepare to file their taxes. And again, just a reminder, we will be sharing some more details and posting our comprehensive open enrollment summary report later this month. Are there any other questions that I can answer? Hearing that, I'll turn that back over to you, Chairman.
Thank you very much, Mr. Chairman. With your permission, I'm going to ask Quentin Oak to give an update on where we are with the 5 to 10 year strategic plan that many of you have been interviewed for and have given feedback, have given input as to what the next 10 years for Access Health should look like. And again, it's a 5 to 10 year strategy. I mean, it's a 10-year strategy, but at the 5-year point, we're going to look at it and tweak it as necessary. So I'm going to ask Kara Mitchell to present the where we are at this point. Kara?
Thank you, James, and thank you. Good afternoon, everybody. Kara Mitchell, Agency Principal with Minson Hoke. I'm joined by my colleague, Andrew Wood, who is also an Agency Principal with me. And you've met most of us, both of us, excuse me, most of you have met both of us through the interviews that we've had. So just to give you a look at the process that we're embarking on, you were each part of the initial stage here, which was gathering an external viewpoint. So we've done a couple of things here. One, we've looked at a lot of primary research that we've completed and the agency has completed over the last few years, as well as some other secondary research in the market. And then in addition, we've conducted 7 stakeholder interviews. Those are with strategy committee members as well as board members. So we've finished that portion of the process, and today we'll report out on some of the implications that we've heard as a result of that process. From here, we're now preparing to go into sessions with the senior leadership team. Our first session will be focused on helping to think more about design thinking and strategic planning with the senior leadership team and discuss the implications that we're reviewing here today with that team in preparation for session 2. And session 2 will be where we will focus on building out those strategic priorities, a full day offsite session where we talk about business goals, audience needs, and prioritization. We start to evaluate the value proposition for various audiences, and we explore the brand elasticity that we have discussed as a result of some of these implications as we look at new products, new strategic profiles for the organization that we want to explore. So we'll move to next slide. There were 5 key implications that we saw as a result of the external viewpoint, and we'll take these one at a time, and we can certainly discuss each of these if anybody has any questions or thoughts. The first and I think most consistent that we heard from each of the conversations was that there's an opportunity to increase our focus on micro markets or segments to continue to decrease the uninsured rate. When we look at the uninsured rate as a whole across the state, we're doing quite well. But when we identify certain geographies or certain demographics, we start to see that the numbers are slightly higher. And so while we've had great success taking more of a macro perspective to date, there's an opportunity to now hone in on some of those micro segments. Mr. Doolittle, I think you just sort of called that out as well as we look at some of the numbers. So how do we pivot and start to maybe look at these different micro markets, as we're calling them, or segments, to continue to decrease the uninsured rate? I think looking even more deeply within some of those micro markets, understanding the healthiness of those segments and what sort of drives healthy behaviors or unhealthy behaviors in some of those areas, so that we can start to look at the totality of those segments and how we can support them best to help move the needle. Which brings us to the next point, which is looking at how we move the needle. And to date, we've really looked at that uninsured rate as the measure for success. And I think we've heard really from everybody that there's an opportunity to step a bit beyond that and start to look at health outcomes more broadly as a measure of success. So not just looking at access to insurance, but actually stepping to a level beyond that to look at how we can impact those health outcomes. And we can evaluate this within our member population, but also we can look at the shift in health outcomes for the state at large. So how that shift that we've enabled from our members can support the state at large. And I think, a couple of things to think about here. There's different ways for us to continue to educate and change behaviors. We've started a lot of this work within the organization, but how we continue to lean in that area to look at those health outcomes. And it really allows us to address the complementary issue of health equity, which is part of our mission overall. The third area or implication that we saw was leveraging our unique understanding of communities and increasing our presence. I think the organization has made great strides in forming an entire division focused on community outreach. We've seen the success as a result of that. Tammy and team have done a great job in that area. And our communities trust us. We have a very unique bond that exists with our members and the community at large. When you look at some of the research, quantitative research that's been completed and understanding the brand health, we are highly trusted by both members and even non-members. And where we're not highly trusted, there's sort of a neutral understanding, which means that's a blank canvas for us to build on. So there's a lot of opportunity there to really lean into the communities, our understanding of communities, and to increase our presence within those communities.
I think, Gara, just if I could just add to both, relevant to both the second and the third points, I think as we look at those communities that are perhaps underserved or skew high and uninsured in health, maybe we've talked about getting a better understanding possibly of the drivers of poor health in those micro communities, so we can better understand how to serve them through information, and possibly work with partners to address those health issues. So a specific understanding of the drivers of poor health in specific communities, in specific geographies.
Mhm. Which brings us to our next point, which is are those strategic partnerships. And I think communities and partnerships go hand in hand. The success that the organization has seen as a result of the Broker Academy to date in building partnerships within communities has been wonderful. And there's more opportunity to continue to grow. I think that does become the next growth opportunity for the organization, because we've heard quite clearly, and we've seen in the research as well, that the opportunity for Access Health is actually to convene rather than create in most cases. And so how do we look at partnerships with provider groups, with systems? We had a lot of conversations around FQHCs potentially as a partnership opportunity, but even bridging to the private sector and looking at additional opportunities that can support that notion of growing and as Andrew just mentioned, solving for the unhealthiness that might exist within communities. And there could be a helping of, facilitating the process as well for health outcomes. A lot of conversations around appointment support, reminders, bridging a connection with other services and supports like transportation. So I think really looking at all sides of this healthiness and how we can support the movement toward greater health outcomes. And the last piece, I think, last implication that we saw, which is interesting, as an organization, we are a quasi-public agency, and that comes with opportunity and challenges. There's a constant need to be both competing and complying as a quasi-public agency. And I think sometimes we forget that we are a quasi-public agency. And so really leaning into all the good that can come with that. We sort of have this challenging position that we have to create our own sustainability, yet we also still need to comply with regulations. I think continuing to frame some of the challenges that we're facing and the opportunities that we face in terms of what that means as a quasi-public agency and where can we push the boundaries on being that quasi-public to make sure that we are being as successful as possible, but also creating the sustainability that we need for the long term.
I think just to add, Cara, I think as we look at the external viewpoints that we drew from the interviews and discussions, and we also look at some of the primary and secondary data we looked at ahead of this, it would be a shame to understate the importance of having Access Health's position in having a brand that is trusted for number one, because the majority of companies, organizations are trending very low on any kind of trust barometers in the country right now, but also you're somewhat unique but respected access into communities. They are two very vital things that the brand owns, and I think to be handled with caution, but also to be incredibly encouraged that you have these two kind of vital components attached to the brand that gives you some real potential, I think. And that's the potential we'll be exploring in subsequent planning sessions.
Yeah. So as we look to the next 5 to 10 years, obviously a really large roadmap ahead as it relates to 10 years, and lots can change, but giving ourselves the opportunity to look at these implications and say, how can we look to adjust? How can we look to pivot potentially to continue to have the success and sustainability we need for the long term over the course of the next 5 to 10 years? I'll pause for any questions.
No questions. Can you hear me? This is Cece.
Yes, Cece, we can.
Yeah, this is really a yeoman's task. And I think your synthesis here is very helpful and comforting. I know I was the first person that you interviewed, and so I was feeling particularly anxious at that, but I see that other people certainly seem to feel some of the same things that I felt about going forward. So I thank you for this excellent opportunity, and I know it took a lot of time.
Thank you, Cece. I'd say in all of the different interviews and projects that we've engaged with, this is probably one where I've seen the most consensus. And so that is comforting. I think that everybody is on the same page. I don't think there are any major surprises here, but it is nice to see it as you documented, outlined as key implications that we can anchor around as we look to work with the leadership to set goals for the next 5 to 10 years.
Exactly. Thank you.
Yeah, thank you.
Thank you, Kara and
Thank you,
Andrew,
James.
for the summary of all the interviews and the input that you have received from our board members. Thank you much. More to come on this, Mr. Chairman.
Thank you for that. Thank you, James. You know, one thing that this reminds me of is that this temperature taking, this guidance that you're receiving through these interviews is probably something that we should continue to do from time to time. I think that's part of what your planning is, and forgive me if I missed that element, but it's just so important in order to provide a constant feedback loop on how it is that we're doing, how we're advising each other, and what our own vision might be as we move forward. Thank you.
Absolutely, Mr. Chairman. Thank you. So the next item, strategic initiatives. Let me talk about that for a quick minute on where we are. Let me Tammy talk about the Broker Academy, then I'll close, talk about the subsidiary. Tammy?
Yes, good afternoon, everyone. Tammy Hendricks, Director of Health Equity and Outreach. Quick updates for the Broker Academy. Things are moving along quite nicely, actually, for the year 2 launch. The new webpage is up with all the new program details, and it's gaining a lot of visitors. So we had over 1,400 visitors to the page last month compared to 391 in December. And, 391 is still pretty impressive because we weren't actively promoting the page in December, and there were still a lot of visitors. So very good insights there. And the analytics is showing us that we're getting visitors from all over the state. But the top cities with the most visitors are from Hartford, Bridgeport, and Waterbury areas. And we know these areas are all high need, higher uninsured rates. So we're happy to continue the momentum in those locations. The recruitment efforts are ramping up. The outreach team has been attending job fairs, doing presentations for community partners and state agencies as we did in year 1. Some of the most recent activities include a job fair that we recently did in Waterbury, a resource fair in Manchester Community College. We've shared presentations, and we did a presentation and shared flyers at the Afro-Caribbean Cultural Center, which was a new partner for us recently. We actually had a presentation at the West Hartford and the Bloomfield Health Department, Stamford School District, Hartford NRZ community meetings. We were at a few churches, and we recently got the Department of Education to agree to share the flyer with all of their adult education directors, which is a big win for us. They'll get to a lot of great candidates through the adult education program that are looking for opportunities in their communities. So a really big win for us there. Over the past week, the outreach team really was focused on reaching out to top partners in all counties throughout the state. So we reached over 80 community partners this past week through phone calls and meetings and presentations. So the word is definitely getting out there. What's great is a lot of people are already aware of the program, so they're ready and willing to support year 2. So it's been going great on to that end. We've also been doing our bi-weekly info sessions. We just had one on Tuesday. I believe we almost had 40 attendees on there. And these are bi-weekly calls that we hold for candidates that may be interested in applying. But also we've had a few brokers come on to those calls to learn more about the program and how they can get involved as mentors. So these calls have been a great success so far as well. So again, just a reminder, we're looking to recruit up to 100 students. We have 2 class locations this year in Hartford and New Haven. The applications are set to open on February 27th, so a couple weeks from now. The application is already built. We're actually just testing it out. We're having a few staff members and the application implementation team sign in, test it out, see what the students have to go through, and we'll make any tweaks if necessary from there. But that's all built, ready to go for the end of the month. And the plan, again, once the students are accepted, we'll host 4 weekly meetings for them leading up to the 5-day class training in June. We got a lot of feedback from the students. They loved the pre-training class. The classes were very important to them, getting them ready for that training experience. So we'll be doing that again. So everything is going really smoothly this year. Again, we had a great framework to work off of. So we're looking forward to opening up the application in a couple weeks. And that's really all I had for updates for right now. I'll open it up for any questions or feedback. They are good. Awesome.
Thank you, Tammy.
Thank you so much.
Mr. Chairman, I have a brief update on the subsidiary and where we are. As Kara and Andrew presented, we are in the midst of developing what the next 10 years for Access Health is going to look like. As you might imagine, for the first 10 years of our existence, we were for the most part reacting in the moment, reacting to what was going on in DC. For the most part, for the first 5 years, every day something was coming out of DC that we had to react to, because like us, they were building up the entire system as we were rolling it out. So there were a lot of changes. So we again, it was crisis management for the first several years. Then since then, we've been reacting also to the marketplace and to what the state is doing, as well as to what the feds are doing. We believe for the next 10 years, we have to develop our own strategy, our own framework, so we could see what our future is going to look like. And as indicated, we are focused. We're going to focus on population health, and also the micro outreach that we have to do to target those those communities who are particularly impacted by high uninsured. Although Connecticut is one of the lowest uninsured states in the country. However, we do have certain pockets in our urban communities as well as in our rural communities that still have high uninsured, 13, 14, 15%. So again, we're going to go from a macro perspective down to a micro and really hone in on the areas that needs continued support to lower the uninsured. But then we're also going to pivot at looking at how do we improve population health for those who are, again, Connecticut is one of the healthiest states in the country. However, we know from our own data, the micro communities, rural communities, urban communities, have some of the highest health disparities compared to the rest of the state. So that'll be one of our primary focus as we move forward. Again, as the information is coming in, and I greatly appreciate the input from Mr. Chairman, you and your community members and some other board members also that we spoke with. They give us the insight as to where we need to focus as we move forward. So for the next 2 months, the SLT is going to be working very closely with Menton Oak to develop a draft 5 to 10 year strategy and come back to this committee to get their input before we go to the board with a final draft. Now, the subsidiary will be one of the tools available to Access Health to execute the next 5 to 10 year strategy that we are developing. Again, part of that strategy is the subsidiary will be a 501c3, meaning it'll be a nonprofit organization that would be able to apply for grants to support some of the targeted work that we're going to do in those micro communities, especially as it relates to population health. That's all I have for now, Mr. Chairman. And I think also Mr. Matthew.
Yeah, I think Matt's hand is up.
Thank you. I mean, I recognize I beat this drum every time, but I believe that the 5 to 10 year strategy for Access Health we should not be assuming that a subsidiary is the answer to whatever that strategy is. The strategy and the goals of the organization should come first, not the idea of a subsidiary in a company. That's a cart before the horse. There's an assumption about what will be in the strategy that I think that is polluting whatever Minton Hulk was going to do. And I said this to Minton Hulk as well. I think that is polluting the product. If the goal of that product is a subsidiary, then that product should not be paid for by this organization. That means you've already determined what you want that report to say.
Matthew, the subsidiary will be an avenue available to us to execute the whatever strategy we come up with. So again, the subsidiary, if we don't need it as a result of the strategy, 5 to 10 year strategy, then we would not have one. But however, we have some challenges going forward that a subsidiary was going to help us resolve. But again, we're taking a step back. Let's develop the strategy, 5 to 10 year strategy with the board's input. Then where that takes us, that'll determine what the next steps are for the subsidiary.
Okay, but you recognize that this slide says that as part of the strategy, we will have a subsidiary. That's the opposite of what you're saying now.
Mm-hmm. Again, the subsidiary, we started about a year and a half ago, right? And then to create opportunities for us to address some areas of concern that we currently cannot do because the ACA forbids us from doing certain types of work when it comes to population health, when it comes to raising additional resources, also when it comes to helping to address some of the challenges across the state of Connecticut.
Our goal is not to address the challenges of the state of Connecticut. That is not our mission.
Again, some of the areas that are specific to our mission, lowering the uninsured and helping to address health disparities.
Right. So I'd like to see it, Minton Hall come back with this, talking about a 5 to 10 year strategy around healthcare and health insurance. And if then at that point, the board decides that there's a structure of a subsidiary that will be helpful to that, that is the conversation for that point.
If I could just jump in for a second, Matt, I think if we can certainly, I'm happy to catch up with some of the key implications that we reviewed a few slides earlier. I think that's exactly the plan. So based on some of the implications that we've heard from the interviews that were conducted, there's obviously a clear need to focus on health outcomes, and that is a core focus of the plan. As we work with the senior leadership team, the goal of those conversations is to continue to find ways to innovate, to improve sustainability for the organization for the long term. That may result in, to your point, the need for the subsidiary to help execute against some of that, but it may not. And so the goal here is to absolutely focus on the plan first and foremost. And then if we need this as an avenue to help us improve sustainability, then that is something that will be explored.
I appreciate that. Thank you.
Thank you all. Any further discussion or reflection?
No.
Anything more, James?
No, I think that was it. Thank you, Kara, for the summary. But our intent here is go through the 5 to 10 year strategic planning process. Then to come back to this committee with your input. Then only then at that point, if a subsidiary is going to help us achieve those objectives, then we will continue down that path.
Great. Well, thank you all. Thank you for this. Thank you for your presentation. Thank you for the work that you're doing and for this robust discussion. So without anything further, I wonder if we can entertain a motion to adjourn.
So move, CC Woods.
Thank you. Any second?
Second, Matt Brockman.
Yeah. Marcin, can we have a roll call vote, please?
Yes, Mr. Chairman. Steve Hernandez.
Yes.
Ron Blader.
Yes.
Paul Philpott, Paul Lombardo,
Yes.
CC Woods,
Yes.
Matthew Brackman,
Yes.
and Theodore Dolittle.
Yes.
Thank you so much.
Thank
Thank you all. Thank you, James.
Thank you.
Everybody.
Bye-bye all.
Bye-bye.
Bye-bye.